Hello and welcome to Contact Tracing Special Considerations for Dementia. My name is Molly French. I direct public health for the Alzheimer's Association, and I'm joined today by John Sheehan, the Associate Director for Public Health. With support from the Centers for Disease Control and Prevention, or CDC, we are really delighted to be here today to talk with you about some of the unique challenges that arise for contact tracing when you're working with people living with dementia and their caregivers. Please tell us about yourself, and there's a poll on the side of the screen, or you may have to mouse up to the top in order to access that. We will also be recording this webinar, and we've muted all lines to eliminate background noise. If you have any questions for us, for John Sheehan or myself as your moderators, please use the Q&A function, and again, that should be on the side of your screen. In the next 30 minutes, we're going to give you, just to continue setting the stage, just a little bit about contact tracing, a little bit about dementia, but then we're spending the bulk of the time talking with our experts from CDC about different aspects of contact tracing and how Alzheimer's and dementia can affect that. And then we've saved about 10 minutes at the end for your questions and comments. And I really encourage you at any time, use that Q&A feature on the side of your screen in order to tell us about, tell us what's on your mind and raise your questions, because we will have time for that. And we're going to be closing the poll in just a minute, so please do quickly make your selection for us. And I wanted to welcome our CDC experts. We're really honored and pleased to have them and be able to bring them to you today. We have Dr. Lisa McGuire, who is the CDC team lead for the Alzheimer's Disease and Healthy Aging Program. She has published over 100 articles and is a member of the National Alzheimer's Project Act Committee, Federal Advisory Committee. She's on numerous other boards and national initiatives. We also have Mr. Benjamin Olivari. He is a scholar with the Alzheimer's Disease and Healthy Aging Program. And we're particularly fortunate to have him today because he has recently been serving on CDC's COVID response team and helping work with the guidance for older adults. For those of you who registered prior to about yesterday at 10 a.m. Eastern, we sent you a link for a pre-webinar background video. We encourage you to watch that if you're just getting started learning about how Alzheimer's and dementia can play out during a pandemic. And it's short and sweet. If you did not get that link because you registered within the last 24 hours, we'll be sending that after the webinar along with the slides and other links that we feature in this webcast. Together with CDC, the Alzheimer's Association, and our National Healthy Brain Initiative partners, we have been working since 2005 to elevate Alzheimer's and dementia as a critical part of public health practice. And I want to point out that in this national consensus document, the National Healthy Brain Initiative Roadmap for State and Local Public Health, one of the recommendations in there is that public health adapt emergency preparedness and response to tend to the special needs of people living with dementia and also taking into account their caregivers. Just as a reminder, a lot of times people think about people living with dementia in nursing homes, but the majority, 70%, are actually in the community living in homes and apartments. And importantly, 1 in 4 may be living alone with a caregiver who's not in their home but is close by, or a caregiver who may be miles and miles away. And that's why we're really urging for contact tracing professionals and their related partners to be able to anticipate and adapt their work in order to meet the special needs of people living with dementia. And in addition, part of that aspect is working and involving caregivers, because about 30% of older people with dementia have 3 or more caregivers. So it's not just one caregiver, but multiple. And I would like to now just bring in Mr. Benjamin Olivari to give us a quick overview about contact tracing.
Okay, great. Thanks, Molly. So I'm just going to give a really brief overview about contact tracing and the best practices for conducting tracing for COVID-19. So contact tracing is a fundamental measure that public health officials take to help minimize the spread of infectious diseases. So generally, when we refer to contact tracing, we are talking about identifying the contacts of an individual who is a probable or confirmed case. So this quick identification, self-quarantine, and monitoring of the contacts can effectively break the chain of disease transmission and prevent further spread of the virus in a community. So as you can see here, there's a flow chart that shows how contact tracing works in practice. So first, the probable or confirmed case is interviewed about recent activities and people with whom the individual has been in close contact. Then those contacts are assigned to a contact tracer, and they are reached out to remotely to let them know that they may have been in contact with a person with COVID-19. And then at that point, if testing is available, the contact would get tested and self-isolate, regardless of whether or not they're exhibiting symptoms. And if they are exhibiting symptoms and require medical attention, the contact should be referred for medical treatment. And even if they are not showing symptoms, it's important that the contact remains self-quarantined for 14 days after the exposure to the initial case subject. All the contacts should be referred to the relevant resources and information. Next slide, please. So now I'm going to walk you through the best practices to keep in mind for contact tracing. So for persons with confirmed or probable COVID-19, contact tracing should be conducted on those individuals who were in close contact, which we define here as being within 6 feet of the infected individual for 15 minutes or longer. Again, to reiterate this, the tracing should be done remotely if at all possible. That should be prioritized. For those close contacts of the confirmed or probable patients, testing is recommended. And for those who test positive, they should be managed as a confirmed COVID-19 case. For those who are asymptomatic and test negative, they should still self-quarantine for 14 days from the exposure to that case encounter. And importantly, if testing is not available, those who are symptomatic should self-isolate and be managed as a probable COVID-19 case. And if testing, again, is not available for asymptomatic close contacts, then they should self-quarantine and be monitored for 14 days from that exposure and be connected with clinical care providers if they do develop symptoms.
Thank you so much, Mr. Olivari. And we know that contact tracing is really essential to boxing in COVID-19 and helping bring down those rates. So we appreciate that overview. And over the next few minutes, we'll be talking more with Mr. Olivari and also with Dr. McGuire to help you better understand how cognitive impairment not only affects memory, but then also can impair or create difficulty in terms of the person's ability to communicate and make plans, as well as care for themselves and get the medical care or additional support services that they may need in order to safely self-quarantine or self-isolate. So with that, I'm going to bring back Mr. Olivari and have Dr. McGuire join us. And I'll put my first question to you, Dr. McGuire. Recently, CDC just updated its guidance, and it's included persons with neurologic conditions, such as dementia and other neurologic conditions, as among those populations who may be at increased risk for severe illness with COVID-19. And it'd be really helpful if you could help us just by elaborating on that updated guidance.
Molly, I'll actually take that question.
Oh, thank you.
Um, Sure. So there has been some modified guidance on the CDC webpage related to those people living with neurologic conditions. Um, so the guidance does say that those with neurologic conditions such as dementia may be at increased risk. So they're not in that higher group of those who are at risk and have been deemed at increased risk. There is only limited evidence to date regarding those groups. So we hope to further examine the data regarding people with dementia and other neurologic conditions to further kind of elucidate and determine whether or not they should be included with those highest risk groups. But I think it's also important to note that there's some evidence that those who undergo an inflammatory response as a result of contracting the virus do experience neurologic issues after being infected, as opposed, and it can be difficult to tease apart whether or not those neurologic issues may have existed prior to the infection, or if they are resulting as symptoms of the infection. And again, there's some other important updates in that guidance that was released recently, which is that previous guidance talked about how older adults were at increased risk, but it's actually the case that risk increases with age, even among those who may be younger or even within those who are older adults. So, for example, if someone is, say, age 55, they might be at increased risk for severe illness from COVID than someone who's, say, 40. And someone who's 85 would be at increased risk compared with someone who's 65.
That's really helpful, and really appreciate you putting some of those critical details that, you read the top line, but it's really helpful, and we all need to be understanding those important, where the science is and also what we still have yet to learn. And I also, just kind of following that up, but switching gears to contact tracing, since that's the focus for today. Can you tell us a little bit, Mr. Olivari, about CDC's interim guidance for health departments on case investigation and contact tracing? It includes paying special consideration to cognitive impairment. And what can you tell us about what that special consideration might entail?
Right. So when we're thinking about this, this means that there are certain situations or individuals for which thoughtful attention needs to be paid because of the additional complexities involved. So people with cognitive impairment are a group that has those important caveats to the normal flow of contact tracing. So for contacts with normal cognitive functioning, answering questions and recalling recent whereabouts and contacts, it's a little bit different in those with cognitive impairment versus those with normal cognitive functioning.
All right, thank you very much. For Dr. McGuire, let's switch to you. And of course, many people living with Alzheimer's and other dementias experience some memory loss, not all dementia, but primarily that's one of the hallmarks for Alzheimer's. And how can that memory loss go into a little more depth beyond what Mr. Olivari said? How does that affect contact tracing?
Well, thank you. One thing that we need to keep in mind is that people who may have Alzheimer's disease and related dementias, that can occur on a continuum. There can be impairment of their thinking, memory, and their reasoning as well. And sometimes there's even day-to-day variation. Some people might have better days than others, or certain times of the day that their impairment, their cognition is more impacted than others. One of the things that we can see with people who have Alzheimer's disease or related dementia is that they may have trouble remembering past interactions or recalling symptoms that they may have been experiencing, or even instructions that they're being given or provided. When working as a contact tracer, it might be beneficial when asking someone with Alzheimer's or related dementia a question, to ask them a question that is a yes, no, or a choice between two or very limited options, as opposed to asking an open-ended question. So, did you have lunch with Fred yesterday, as opposed to who did you have lunch with last week? So asking some specific questions, and that might get some better response. The thing to keep in mind as a contact tracer, you probably will encounter some people who do have dementia, because as Ms. French pointed out at the beginning, 70% of people with Alzheimer's disease and related dementias reside in community settings.
Thank you. And I loved just some of your practical tips that you had, and just being able to anticipate that. We know that, and you alluded to this, Dr. McGuire, that Alzheimer's and other dementias affect other aspects of cognition. And one in particular that two in particular that we know of that are very relevant to contact tracing, and one is a little bit more on communication, but then also their ability to plan. And what would you say to a contact tracer? What do they need to know?
Well, I think it would be recognizing that that is a possibility. So as we talked about the thinking and the reasoning, which is really going to get into that planning, it's more than just that memory component or the memory aspect. So there may be comprehension issues with questions or instructions, or a person may even have some challenges articulating their responses, even if they do know the answer. So maybe one of those things where they say it's stuck on the tip of their tongue. But also, in addition to some of that planning, maybe verbalization of the responses, sometimes people with Alzheimer's disease or related dementia can be very suspicious and very paranoid. Like, who are you? What do you want? And may believe that you're trying to cause them harm, and may even have some hallucinations or appear uncooperative. But it's, keep in mind that it is the disease process and not necessarily you as a contact tracer. So with all these great intentions that we have in trying to understand the interactions of that person and who they might have, been in contact with, we need to think about, as I said before, Alzheimer's disease and related dementia, the disease process occurs on a continuum. Some people might have very mild impairments. Some people may have more severe impairments, and they may have a caregiver or somebody who is helping them out. So I would encourage, as a contact tracer, to think about involving others to get some of the responses to these answers or to the questions, or trying to get follow through with instructions or guidance.
And that's a wonderful point. Thank you so much for bringing up caregivers. We know caregivers may be there in the home, for example, a spouse or an adult child, or even a teenager who's helping out, or a multi-generational household, or maybe someone who's distant. And there may be multiple caregivers. What would you say, in addition to thinking about those caregivers, what else should the contact tracer be considering?
Well, the contact tracer, if there is a caregiver or caregivers that they can also use to maybe either validate or get the responses to the questions that they need, I would encourage them to do that, as well as making sure that they're communicating with that person, with the check-ins, what the next action should be, whether they need to be getting tested, when, where, etc. But one thing to keep in mind is, Ms. French pointed out that, about a third of people with dementia living in a community have 3 or more unpaid caregivers. These can be family, these can be friends, these can be neighbors. They might be in the neighborhood, or they might be across country. So we have to keep that in mind, that not all caregiving situations look the same. But the other thing to think about that can complicate a situation is about, as Ms. French pointed out at the beginning, 26% of people with dementia who live in the community also live alone. So there might be a caregiver to assist, and there may not be a caregiver to assist. I think that's a question that's always very good and worth investigating. And then also, if there is a caregiver, I would encourage you to help the caregiver in the sense of telling the caregiver to make sure that they're taking care of their own health, that they're getting tested, and that they are thinking about their family and their work situation and responsibilities as well.
Oh, thank you so much. Yes, and that's a really an important point about thinking about the caregiver, not only in terms of supporting the person with dementia, but then also the caregiver, if they are in the home and they're self-quarantining or self-isolating, how that caregiver, they may be experiencing a little more self-isolation, and it may just be a more stressful situation than they normally have, and how to best support the caregiver during that period. It's just about time for us to switch over to our participants' questions and answers. I'm going to ask Mr. Olivari one final question, and that's if a person with dementia does need to self-quarantine, self-isolate, what kinds of assistance may they need support or assistance with?
Sure. I mean, self-quarantining for persons with dementia presents numerous difficulties. So just a few of which are adhering to safety recommendations that, are the typical recommendations that are given as guidance for the general population when they need to self-isolate. And that can really affect managing chronic conditions. It can increase potential agitation or other disruptions to normal routines for persons with dementia. And again, reiterating some of the points that Lisa made, which are, for those with more severe cognitive impairment, having a caregiver to assist is extremely important in maintaining that safety. But it does also put the caregiver and the caregiver's contacts at risk for infection themselves. And furthermore, the caregivers are often older adults and are at increased risk for severe outcomes themselves, and if they do become infected with COVID-19. And again, it is important to identify multiple caregivers, backup caregivers, and contingency plans for how to maintain the well-being of the person with dementia. So if a caregiver is not available or they cannot safely assist the person with dementia while they're self-quarantining, then the contact tracers and other family and friends should help to develop backup plans, such as a plan for short-term 24-hour care or receiving all the medications that they might need.
Excellent. And just to bridge off what there at that point, also thinking about, right, how do we, if the person does live alone, how do they get to to be retested? Are there daily calls to check on their adherence, see if they need anything, because they may have difficulty solving problems if they do arise, or need assistance recognizing, for example, that they're starting to run low on food and connecting them with that source of meals. Thank you so much. I am going to go ahead and switch over to my colleague, John Sheehan. John, what are some of the questions and comments that we've gotten?
Thank you. Thank you so much, Molly. We've gotten a lot of questions coming in today, and so unfortunately I know we will not have time to answer all of them, but please do keep submitting those questions. We'll follow up individually after the webinar with those that pertain to dementia. And one of the first questions I'm going to start with is actually for Dr. McGuire. Dr. McGuire, you had said earlier that for someone who is experiencing memory issues or cognitive difficulties, closed-ended or more pointed questions might yield better information from that individual. We have a contact tracer on who's listening today whose training taught her specifically to use open-ended questions to gather more information. So the question is, how could a contact tracer potentially identify someone that does have cognitive impairment or may be living with dementia?
That's a really good point, because normally when you're asking questions, you don't want to limit people into a response. And especially with contact tracing, you want them to think about everybody in every situation they've been in and let them think broadly. So my suggestion would be, and I think it comes from cognitive theory, that, if we all think back when we were in college, we all liked multiple choice questions. better than we did open-ended essays, because the cognitive load on answering those questions is easier, because the information you need to retrieve that information there's more retrieval cues to get that information from memory. So my suggestion would be is if you're working with a person that you're concerned, if you're noticing that maybe they're not following you, or they're just, and a thing to also keep in mind too is if somebody's not responding to you, it might be cognitive, but also think about hearing as well too, because my mother will sit and nod and smile, and you think she heard every word, and she only heard about every third word. So you want to make sure that, the challenge that you're having is is it a hearing or is it a cognitive issue? When you're working with someone, an older person regardless, you definitely want to look eyeball to the best you can, and also make sure you're enunciating the words, because that will also help with the comprehension of the person. And if they ask you to speak louder, because they're not hearing you. So my suggestion would be, if you ask broad questions like, what'd you have for breakfast this week? Or what'd you have for breakfast today? And you kind of get a blank stare, ask the question again, and if you're suspecting that there's a cognitive issue, then you might say, did you have eggs or waffles for breakfast? So I know that's a rather vague answer that I'm giving you, but I mean, if you have to think about from cognitive theory, when you ask the closed-ended questions, you're providing the retrieval, and the goal is to get as much information and get it as accurately. You might not get it as quickly, but we want to try to, get the information that we need. John?
Excellent.
Yeah.
Yeah, thank you, Dr. McGuire. It's a very tricky situation, I'm sure. So that adaptability, seeing if there is kind of that hesitation or that lack of clarity that you're noticing, then it might be appropriate to change the line of questioning. I know we're getting near the end of our session today, so I'll take just one more question for Mr. Olivari. Mr. Olivari, what factors should be considered when assessing whether a person living with dementia can isolate safely at home? I know you talked about caregivers, but what factors should go into what exactly a person living with cognitive impairment does need to remain safe at home?
Sure. So I think just broadly speaking, I mean, it's going to really vary depending upon each individual situation, but I can just say more broadly that underlying chronic conditions are going to increase anyone's risk for severe outcomes from COVID-19. So the focus should really be on those people who do have underlying conditions and need to manage those conditions, whether it be a heart condition, multiple conditions. But that's, I would say, the most important thing. So, and as many of us know, those with mental problems such as dementia, they have an increased incidence of those comorbid chronic conditions. So I think if you're able to identify whether or not that person, that contact who has dementia and needs to self-isolate has underlying chronic conditions, then we can refer them to potentially some sort of short-term care facility, to like a 24-hour care facility, to get their other chronic conditions managed, and a care plan in place for potentially isolating at home.
Excellent, thank you. I know that care plan aspect is super important just for many people who are living with dementia. That is, I know we're nearly out of time, so Molly, I will turn it back to you.
Thank you so much, John, and thank you very much to Dr. McGuire and Mr. Olivari. Thank you so much. You gave us both a broad understanding, but then also some really pragmatic ways. Just any contact tracing program can make some adjustments to be working effectively with people living with dementia and their caregivers. For our participants, thank you so much for joining us. We are very interested in learning how to better serve you. And I will ask John to please put that URL for our feedback form in the chat, so you can just copy and paste from the chat feature. But please do spend just 2 to 3 minutes giving us your impressions of today. Again, we'll be sharing the slides later this afternoon with everyone who registered. As you can see, CDC has a wealth of information, and there's a collection specific for professionals who work with older adults, as well as information and guidance for older adults directly themselves and their caregivers. You can find that at cdc.gov/aging/COVID-19. Very easy to remember, cdc.gov/aging/COVID-19. And with CDC support, John and I and your public health team here at the Alzheimer's Association, we've put together the tip sheets that you see on the right side of your screen, as well as additional webinars that you can access on our microsite, which is, again, simple to remember, alz.org/publichealth-COVID-19. You can access there's links here to other parts of the association's COVID-19 information and resources. You can stay up to date on Alzheimer's and dementia, including COVID-19, by subscribing to our newsletter. And we also have a wide array of educational webinars and content on our Action Alz Public Health playlist. We've talked about making sure contact tracers are ready and to work with people with dementia. And Dr. McGuire spoke about the continuum. At training.alz.org, the Alzheimer's Association has short instructional videos just about different stages of Alzheimer's and dementia, and also on communications. If you wanted to go more in depth, the Health Resources and Services Administration has training for primary care providers about Alzheimer's and dementia. And some of these courses, online courses, may be helpful and beneficial for contact tracing. With CDC support, there are continuing education units available for that HRSA training. And again, thank you so much for joining us. Thank you, Dr. McGuire and Mr. Olivari. We really appreciate your time and being able to tap into your expertise. And thanks to all of our participants. Later this afternoon, we'll be sending you that follow-up email. And then next week, we'll have the recording available for you. Again, we'll notify you by email. Thank you so much, and have a very safe and healthy 4th of July, everyone.